Very much for inviting me today to speak about Skills for Change and the services that we provide to internationally educated health professionals. Before I talk about that, I just want to speak a little bit about Skills for Change, the organization, and I'll talk a little bit about our program. So Skills for Change, about 31 years ago, were established to provide with, initially providing services to Vietnamese immigrants, women, 6 women with clerical services. We got 6 typewriters donated by IBM, and that's how we started. 31 years later, we provide services to 14,000 clients per year in 5 locations across the GTA. Our focus as an organization is to, we focus on, we see Canada where every immigrant succeeds. The bulk of our clients are immigrants. We service immigrants and refugees, providing training, employment training, language training, mentoring, and settlement services to enable newcomers to, integrate effectively economically in Canada. What we've noticed over the years, with a variety of programs that we have, we developed the Skills for Change. We had a very significant healthcare program where we help, newcomer doctors to transition effectively into their field. What we found with that is the various gaps in licenses or languages, etc. Unfortunately, a few years ago, even though the program was very successful in helping newcomer doctors to really transition into various careers in the healthcare field, we lost funding. So for the last few years, we've had to really redevelop new programming in order to help healthcare professionals. So some of the barriers that we encounter, from licensing to languages to employment in their field. And so we were very excited to looking at what the Ontario Human Rights Commission focus, that it's no longer, you cannot ask for Canadian experience in general for certain jobs. So that was very exciting for us because we can really help people in transitioning to whether it's language and employment skill sets and networking and mentoring, and there's one less thing that hopefully we will see a shift in the next few years. But in helping our clients in overcoming barriers, what we provide at Skills for Change are enhanced language training, and of course training on medical terminology and employment Ontario programs. So for us, in helping internationally educated health professionals, it's important that they have really good understanding of the language skill sets, but also look at increasing knowledge of the labor market, understanding workplace culture and cultural competency required to be effective and integrate well. So it's not just about getting a job, but it's getting a job and it's retaining that job and growing within a job. So cultural competencies is really important. Targeted resumes, enhanced networking, identifying suitable job leads, and connecting with a mentor. Skills for Change pioneered a lot of programs and initiatives, and one of the things that we pioneered in GTA was mentoring. And we match hundreds of people per year with mentors and mentees. And mentoring is really critical for successful employment, both engaging and retention. In addition to the enhanced language training, we also provide ESL and medical terminology training, and that is in collaboration with the Toronto District School Board, and we provide that also on the weekends. So Saturdays at our 791 St. Clair Avenue West location, we provide this particular training, helping newcomers to develop the communication skills and learn occupation-specific language for the medical office setting. So that's very important when we look at people trying to transition their careers in different healthcare settings. But of course, the very critical thing is getting a job. And we have 2 Employment Ontario locations where we help newcomers in being gainfully employed. And to successfully transition in Canada, it's critical that you are able to economically integrate really well and to remove the cycle of precarious employment. So through Employment Ontario, we do client service planning, information and referral, job search, mentoring, cultural competency, communication training, and workshops that really helps people to successfully enter the labor market. And we have about a 70% success rate of our Employment Ontario clients getting a job. So what we've done, when we lost that really significant funding for career transition for medical doctors, we didn't get rid of that information and all those resources. What we did was embed that with an Employment Ontario model. And so through that, we do workshops. And this, every 2 months we do workshops, 1 week fully engaged to train and try to condense, something that would have done over months in a few days. And we have a huge waiting list because there's such a demand for this particular service, so we try to ensure that there is access to that. And so here we do targeted resumes, we do innovative job search techniques, we focus a lot on specific alternative careers in healthcare or specific care information related to the healthcare field, where there's regulatory knowledge and key associations, so there's care that someone should go and join and be a part of. And of course, mentoring a lot is very critical for people to build a network and gain the connections that they need to be successful in their field. Another thing that we're part of is the IEHB Navigator project. So this is looking at how advanced online technology could help in competency building and assessment for healthcare professionals, and then really matching them with human resources requirement in real time. So this is a really interesting piece of information that we're trying to support through research, and you can learn a bit about it at the website listed here. But in addition to mentoring, in addition to employment services and enhanced language, we do provide settlement services, so counseling and support and workshops and information to healthcare professionals so that they can really engage as thoroughly as possible so that they can effectively enter into their field. So as an organization, from employment to settlement to mentoring, we, at the 5 locations, we try to ensure that we have a lot of the specific needed services that newcomer healthcare professionals would need. And people with specific expertise in that area who delivered our career transition program are still embedded in our various programs and services, so they understand the unique needs of healthcare professionals in Ontario. Thank you.